Hello friends, my name is Dr. Sujya Shankar Mehr. I'm a chest and respiratory physician and I'm here to help you with your health queries. The main aim that I have created this YouTube channel is that I can help you with your health queries and help you to lead a better and a healthy life. So now coming to today's topic. Today's topic is sleep and sleep related disorders. As we all know, March 15th has been celebrated or is being celebrated as World Sleep Day. The 2024 theme being sleep equity for global health. So now, why March 15th has been chosen, or a day has been chosen, so that it can be celebrated as this World Sleep Day. So with this, we come to know the importance of sleep in our life, sleep and sleep related disorders. Nowadays people are facing many we are facing, and we as physician also see many people facing disorders or having problems in their lives because of inadequacy of sleep, inadequate sleep. So the term came sleep related disorders. Now as we all know that life runs in cycle. After every day there is a night, and after every night there is a day, and then comes again night. So in the same is with the human body or the all forms of life. They take rest, they have some work, they work for some time, then they again take rest, become ready for next cycle, they again do some work, then again take rest. So this is a cyclical form that exists in nature. It cannot be denied, and from times immemorial, the same thing is on. So now we'll today discuss. I will first explain or discuss something about sleep related disorders. What is the importance of sleep? So now jumping also to today's topic, sleep. As we all know, if we don't have a good sleep, then it affects our next day life. Like suppose we didn't yesterday night, if I didn't have a good sleep, then today the whole day I'll look tired, I'll not be energetic, I'll not be vigor, I'll not have that vigor to work with, and I'll feel sleepy during the whole day. But still then, because there is a rhythm entangled in your brain, so you cannot sleep during daytime. Again at the night you will come to sleep, you will not have that good amount of sleep. This carries over. So basically one loss of one night of sleep has costed you almost 2 to 3 days. So regular sleep is important. 6 to 8 hours is normal for people to sleep. Some people sleep less, some people sleep more, and neither of it is good. 6 to 8 hours is adequate time that you do sleep. Now coming to sleep disorders. Sleep disorders are like you classified as insomnia, hypersomnia, parasomnia, sleep related movement disorders, and circadian rhythmic disorders. Now coming to insomnia. In insomnia, you don't get proper amount of sleep. You have less amount of sleep. The causes can be many. We'll discuss it later. And now coming to hypersomnia. Hypersomnia is you have excessive sleep, or you sleep more than 10 to 12 hours, and basically the causes are limited, but it may be due to narcolepsy. You have the habit of taking some uh, abusing some drugs, then you have to develop this habit. And if again a syndrome known as clean levine syndrome, that is sleeping beauty syndrome, it can also cause the same. And other causes are the causes are not known, so it has been classified broadly as idiopathic. So idiopathic hypersomnia. Now coming to parasomnia. Parasomnia is like something unwanted or abnormal movements during sleep. Like abnormal movements during sleep, like you have seen in movies, the people they show that रात में चलने की बीमारी है, नींद में चलने की बीमारी है, that is night walking basically. And these the kind of sleeps are related to various phases of sleep. We have this, in sleep we have REM and NREM cycle. So some are related to REM cycle, some are related to NREM cycle. So those related with the NREM cycle, We can have that night terror, sleepwalking, or these all come in NREM related. And REM related, we basically get nightmares during this, and others can be classified as you have that hallucination or bedwetting. Then it can be classified into that parasomnias. Now sleep related movement disorders like restless leg syndrome, people have this suffer from this before or during the sleep. They have this movements of their leg, or they feel some unusual sensation in their leg. It is a different topic to be all total to be covered now. And other is the circadian rhythmic shift disorders, or circadian rhythmic disorders. Basically, these are found in people those who don't have this adequate amount of sleep, people suffering from having night duties or shift duties, and this is also seen in jet lags. Okay, now go in detail in insomnia and this circadian rhythm. So first, coming to insomnia, that is you don't have a proper sleep. This can be due to, and all in general I'll talk all about this sleep. In that thing is, if you don't have adequate amount of sleep, then what are the symptoms that you will face? You will face low mood, you will face uh, fatigue, you will face uh, you will feel sleepy, you will feel very depressed or low, you will have abnormal behaviors, you will have behavioral mood disorders, you will feel irritated, you will feel agitated, and you don't have that vigor to work. You feel very disheartened, and for some strange reasons you can face these things. So if you don't have a proper sleep, that is, if you have that inability to sleep, then you can have these things. And one very important thing is that if you don't have a proper sleep, then you don't have a proper concentration, don't develop a good memory. And these all things are also very important from a student's perspective, and adults also. But students, this is the first priority. Okay, now coming to what actually are the causes for insomnia. The causes of insomnia, basically insomnia may be due to, you may have this due to some psychiatric illness. You have that this habit of uh, worrying, or excessive anxiety in you will not let you have a proper sleep. That comes under mood disorders. And also, if you have this habit of smoking, then you can develop obstructive sleep apnea, obstruction, and which leads to OSA kind of thing. In obese patients also, this is also seen, this obstructive sleep apnea. And in patients those who are overstressed, overworked, they also don't get proper sleep. So basically, this is a change in lifestyle also can lead to such things. And now, in older age, we can see those who have problems in their those who are suffering from BPH, those who have this habit of frequently going to for urination at night, they also don't complete their sleep cycles. So basically, they also suffer from these type of diseases. So sleep itself is a very big topic to cover in a short video, but what I am giving you is in such some insight that will actually help you in knowing if you are actually suffering from it or you are not suffering from it. And nowadays, insomnia is also seen in teenagers, and the reason being mobile phone. So this is a very common occurrence that you are sleeping and the mobiles fall on your face. This is a very common occurrence nowadays. Earlier, when during the time of our father, when they used to have this habit of reading books at night, and they used to go to sleep. But nowadays, all are at all eyes on the screen, the white screen, and the face. When you fall asleep, the white screen falls on your face. This is the common phenomenon. Okay, so we cannot do this is because of evolving lifestyle. We are getting these kind of disorders. These sleep disorders have grown because of only this kind of things. These sleep disorders have risen quite drastically because of behavioral modifications, because of lifestyle modifications, and we can see all this very common part and parcel of your life. So these are basically related to insomnias, and obstructive sleep apnea is itself is a very big topic. So people suffering having this disease as COPD, they usually suffer from OSA, develop into COPD, and many such kind of things, which needs to be explained in a great length and a greater detail. So that can be left for some other videos, some other video. Okay. Now I'm coming to the back to the topic. We also see some circadian rhythmic disorders. Basically, it is seen as jet lag. When you are traveling to different country, you come back to your own country, you sit there at night, you should reach by morning, but you will reach your country by morning. So there is a jet lag. And it is also seen in night shift workers or shift workers. Basically, who are shift workers, they carry out their shift. Sometimes we basically in medicos we also have that, and we have 4 nights at a stretch, and this is very bad. This should not be. Basically, if you are doing shift duty, then the pattern should be morning, evening, night, then morning, evening, night, so that the body falls in a rhythm, rather than having this 4 continuous nights at a stretch, or having morning, evening, night, morning. This random pattern should not be followed also. This is very bad. So to the body to adapt itself, so what precautions can you take during night shifts? Basically, when you are in night shifts with your co-worker, then you can take some short naps during that your night shifts. Take a 20 minutes or 30 minutes nap. Then after taking that, get up and immediately open your eyes to bright light, so that reflex is gone to your brain. A reflex goes to your suprachiasmatic nucleus, which again sends the reflex and adjusts your circadian rhythm according to the cycle. So basically this is seen in shift workers, and maximum people can correlate that these type of problems they face, those who do shift duty. And this is also due to the lifestyle modifications, work stress. This has all developed. And when we remain awake at night, we also develops this gastric or acidity problems, basically at night maximum. So one thing leads to other, then leads to other. So basically you need to take care of yourself to have a good sleep. This is the most important take home message. And one more important segment is children's. In small children suffering from adenoids, or are having some kind of this malformations. So basically what happens is their oropharyngeal pathway is not sufficient, and they don't get sometimes one most common is adenoids increase in size, so their oropharyngeal passage is blocked. They don't get proper oxygenation during night, so they remain awake during the next morning, and during the night they don't get a proper sleep. They get a broken sleep. They will sleep for 5 minutes or 15 minutes, 20 minutes, then again wake up and again. But these being as they are kids, or they don't realize this. So what they will present as, the parents need to be very aware of that. If your child does not develop, has a poor concentration or poor memory, does not perform well, so it is not necessary that always you scold your child and tell that you are not studying well, or you are the only cause. These some sleep related disorders also causes, and they can also lead to these things. So basically consult a doctor ki why there is this lag, and consult a doctor, try to fix the problem. If there is, then the improvement you can see in your child. So basically you need to be to just, this is an awareness video. I need to make you aware, so that basically you get the insight of sleep in a nutshell. And this video will serve that purpose. So basically if you have this look at this video, then you can understand the various disorders that sleep is leading to. And there are many more disorders, many things to be discussed, but in a nutshell I've given a brief of all the things. I've tried to touch all the things, I've tried to touch all the aspects. So if required, sometimes you need to watch this video and take the important gist out of it, and this video will definitely help you to get something, so that you can increase your awareness about sleep. So do share this video to someone, someone who is near and dear to you, so that he also benefits out of it. And I have created this channel, so do subscribe this channel for more such videos. And if you have any doubts regarding sleep, you can post it in the comment box. I will try to reply as fast as I could, and I'll try to help out, out you help you out with your queries. So this is all from here. Thank you. Bye bye.